Good day, ladies and gentlemen, and welcome to today's State Policies and Practices to Promote Father Involvement. All lines have been placed in a listen-only mode. You can submit a question throughout the webinar by using the chat feature located on the bottom left-hand side of your screen. We will be addressing all questions at the end of today's presentation. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to Jessica Pearson. Ma'am, the floor is yours.
Thank you very much, and good afternoon to everyone. Welcome to the FRPN webinar, State Policies and Practices to Promote Father Involvement. I direct the Center for Policy Research in Denver, Colorado, and I co-direct FRPN along with my colleague Jake Fagan of Temple University School of Social Work. The FRPN is now it's in its sixth year. It's a cooperative agreement with the Office of Planning, Research, and Evaluation, and it targets fatherhood researchers and programs that serve low-income fathers. For a little quick overview, we seek to promote rigorous evaluation. FRPN has developed new measures of fatherhood program outcomes that have been validated for never married low-income fathers, and we are doing work on co-parenting research as well. We also have awarded 20 sub-awards to research and practitioner teams around the country to evaluate various aspects of fatherhood programming. We are committed to building evaluation capacity, so we conduct webinars like the one that we're having today, as well as doing workshops on evaluation research at conferences for practitioners, and we disseminate information primarily through our website, www.frpn.org, and we have an online newsletter called Blueprint that keeps you public abreast of new developments, new research that we post, new webinars, and other type of activity. We've also just released state planning grants, small grants, to 11 states to develop planning efforts to engage fathers in policies and practices in their various state agencies and at the county level. And the 11 states that we're working with are listed on this slide, as well as the recipients. Child support directors are part of the planning team in every one of these states. It was a requirement, and these states will be producing action plans to further father involvement and engagement after this small planning effort ends. On to today's webinar. First, I want to let you know that this is being recorded, so if you want to refer to this again, it will be on the FRPN website along with today's slides. And I'm really delighted to introduce a very exciting panel. We have Fran Pardas Abadesa, who is the Child Support Director for the Office of Child Support Services in New York City. Sasha Roscoe, Associate Commissioner for Prevention and Early Intervention for the Texas Department of Family and Protective Services. Fernando Medeiros, who's on the faculty at Simmons College in Massachusetts. Ann Ream, who's the Director of Community Relations and Foster Care for the Summit County Children's Services in Ohio. And Cynthia Osborne, Associate Dean for Academic Strategies and Director of Child and Family Research Partnership at the University of Texas in Austin. I want to lay the framework for today's webinar for just a moment, and pose the question and try to answer it a little bit, of why we are doing a webinar on policies and practices to promote father engagement at the state level. I think the most important reason is that fathers are important, and more research is showing that father engagement improves child outcomes. But for many human services agencies at the state and county level, this is not a normal practice. It's not been the way agencies have done business. And so we have to, in a way, self-consciously stand back and look at policies and practices and kind of audit them for their inclusiveness. I think this also ties up with a new initiative that's being promoted at the federal level by the Administration for Children and Families. Back in October of 2018, they issued an information memorandum that urges all human services agencies at the state, local level to enhance paternal involvement, and that I think, articulates the administration's desires in this area and provides strong rationale for this. At this point, few states have councils or commissions to create policies and practice for father engagement, to audit existing policies, to consider father engagement in statewide initiatives for cousin issues such as two-generation approaches or foster care, recruitment to foster care parents approaches, and other kinds of initiatives that deal with child well-being. But some states are exploring more in this area, are developing and pursuing promising engagement policies and procedures. And we want to bring some of that to your attention. And we're starting off, we think, with sort of the agencies that have the key stake in father engagement and involvement with children and families: the Child Support Agency, the Child Welfare Agency, and the agency that's concerned with child health and child development. So that's the rationale for today's panel, and it guided our selection of our terrific panel. And we also are totally convinced that research can move the policy agenda forward, and research is needed to sustain any momentum that is developed in the policy area. So we have a research presentation in store for you as well. Without further ado, I'm going to turn the webinar over to Fran of New York City to talk about child support and their efforts to adjust orders for low-income fathers, pursue debt forgiveness, connect fathers to employment, try to engage fathers to avoid court involvement, to meet fathers where they are, and to improve communication. Fran?
Thank you, Jessica. Thank you for inviting me, and I'm thrilled to be here today representing the New York City Child Support Program to talk about the efforts we're making in New York City to engage fathers with the Child Support Program. I'd like to start first by just taking a quick look at our caseload. I'm not going to go through every number, but I want to draw your attention first to the pie chart that shows that we have 330,000 cases in New York City, and if you look at the blue and the orange section of the graph together, the pie chart, you'll see that 55% of our caseload the custodial parents are either currently or formerly in receipt of TANF services. And we also say cash assistance. We use those terms interchangeably here. If you go to the right of this slide, you'll see look at our caseload for the non-custodial parent side, and you see something very similar. You see about 58% of our non-custodial parents are either currently or formerly in receipt of some form of assistance. So basically, we are serving a predominantly lower income parents or custodial and non-custodial parents. If you go to the bottom left of this slide, you see that we serve 369,000 children under the age of 21. That's 1 in 6 children in New York City. Now, if you move to the right of the slide on the bottom right, about 80% of our cases have an order in place, or a little bit over 80%, and we're really proud to say that we collect over $750 million every year on behalf of New York City children, of which the vast majority of that money goes directly to families. So we spend a lot of time thinking about debt in New York City. We take a two-pronged approach. One is we look to try to avoid debt in the first place by helping non-custodial parents make certain that they have orders that are aligned with their income that they can afford to pay in hopes of avoiding debt going forward. And then we know that we have a lot of non-custodial parents who have accumulated debt for a myriad of reasons. So we've designed programs to engage them and to help them reduce that debt. And when I say debt, I mean debt owed to the Department of Social Services in New York City alone. We do not have the authority to reduce debt owed to the custodial parent. So that's what these programs are targeted for. Our first program is called Modified DSS Orders. So what it does is it allows non-custodial parents whose children are in receipt of cash assistance and whose orders are payable to the government to come into our offices, and so long as that they can show us that they're earning below the state self-support reserve, we will reduce that order in our office with the court's ultimate approval. But the non-custodial parent does not have to go to court. And we're a judicial state, so this is a big thing. And we've reduced orders by 91%. So on average, people are walking in with a $364 order and walking out with a $33 a month order. Our second program is called Arrears Cap Program, and this is for non-custodial parents who can show us that their debt accrued while they earned at or below federal poverty. And if they can, then we'll reduce the debt for that period down to $500, and it'll stay at $500. And since 2008, we've assisted 12,000 non-custodial parents, and we've reduced nearly $100 million in debt owed to the Department of Social Services. Our third program is the Arrears Credit Program. This program we recognize is for those non-custodial parents who can't demonstrate or show us that the debt accrued while they were earning at or below federal poverty. So what they have to do is pay whatever the court order says they're supposed to pay, and if they do that for 12 months, at the end of the year, they can get a $5,000 credit towards their debt owed to the Department of Social Services, and they could stay in the program for 3 years, allowing them to realize a credit of $15,000. And since 2010, we've reduced about $8.4 million in debt for 800 non-custodial parents. And we have some other programs. So, for example, we have Paid Off, which many may have heard of. This is it's a short period program where a non-custodial parent can come into our office, make a payment towards their debt, and we will match that debt. In 2018, for example, we collected $1.4 million and reduced $3 million in debt to the Department of Social Services. And we've offered this program multiple times, and over the cumulative times, we've reduced $12 million in debt. We also have merged debt programs into our employment programs and into a program called Families Forward. However, we also understand that for some non-custodial parents, they also owe debt to the custodial parent, for which, as I said, we have no authority to compromise. So what we have done is we've created partnerships with mediation programs in the city in hopes that parents will go to the mediator and talk about how they might reduce that debt to the custodial parent. And then we also have early intervention programs. So we have an early intervention program that reaches out to young non-custodial parents, 24 and under, who have a brand new order, welcomes them into the program, makes certain they understand what their order means, connects them to any services they might need, and makes certain they know what to do if their circumstances change. So next slide, please. So the reason why we spend a lot of time thinking about debt and have programs in place is twofold. One is we know from all the research being done that debt, whether it's child support debt or other debt, is negative for individuals. It can make it difficult for them to stabilize their lives. It can make it difficult to connect to children. It can make it difficult to connect to a job or retain a job. So trying to help people reduce debt is important to us. But what we also know, both from research and our own experience, as this chart shows, is when we can reduce debt, it leads to increased compliance with child support. And that's what we care a lot about. And we see these debt programs as a win-win, a win for the non-custodial parent and a win for the child. So our first program that I mentioned before, MDO, we saw that participants were paying 35% before they participated and then 50% after. For our Rears CAP program, it went from 51% to 63%. For our 2018 paid off program, 178 NCPs paid off their debt entirely. And then what we saw was a 52% increase in the average monthly payments for the remaining non-custodial parents. So we believe we're on the right track here. We also place a great deal of importance on employment. It's a cornerstone of our program for obvious reasons. If you're not working, you can't pay your child support. So our program is called Support Through Employment Program. And in 2018, we're pleased to say 1,600 NCPs actually secured employment at an average wage of about $14. And we collected $2.7 million in child support income associated with all those non-custodial parents who are referred into the program. Again, what we see as a win-win policy. Next slide, please. This program is called Parent Support Program. It's our effort to try to meet non-custodial parents where they are, and it's a problem-solving approach towards connecting non-custodial parents to employment, to services, and to other programs to help reduce barriers that they may have that's preventing them from paying their child support. It's targeted to non-custodial parents who are in court for non-payment, and it assists them in making those payments or getting their barriers reduced. We've had it started in Brooklyn, and in Brooklyn we've collected $5 million since the program started, and we've had 353 non-custodial parents graduate from the program. It is recently opened in the Bronx and will open soon in Manhattan. We are continually trying to modernize our services to improve services for both custodial and non-custodial parents. And one thing in particular that we're focusing on is we're creating a new service model for young parents aged 24 and under. So we know from research that young parents, their brain is not fully developed yet, and they need additional support. And so we feel we have a responsibility to help them navigate and hold their hands through this complex child support process. But in addition to that, we know that young parents have young children. So what better opportunity, and we feel the child support program is uniquely positioned to intervene and support these young parents themselves, trying to connect them to education, to employment, to healthy relationships, to parenting classes, to get them off to the best start, and ensuring their children, too, are connected to services. And we believe this approach will truly has a two-generational anti-poverty approach. In addition, we use a behavioral economics approach to communicating with our parents. Any notice that we have that we're in charge of, we try to modify to move it away from the traditional heavy text to actionable, proactive steps to help non-custodial parents and custodial parents. And a good example of that is our summons package. So the summons, because we're a judicial state, remains very complex, long sentences, a lot of legal words, and a bit intimidating. But what we've done is we wrapped it around with documents that help non-custodial parent understand what the document is, why it's important, why they should show up to court, what documents they should bring to court, and offers them the opportunity to get their questions answered beforehand if they wish. And our hope is that it will lead to more non-custodial parents keeping their court appointment and coming prepared, which means that they'll get an order that's aligned with their income, and hopefully they'll have less of a debt walking out of court. We've begun texting non-custodial parents and custodial parents to remind them of their court appointments and other important information, and we're improving our customer services model to in multiple ways. One, we're bringing services into the community. So right now our primary office is one office in Manhattan, but we've opened up our family court offices so that non-custodial parents can come in and get assistance on select customer services issues. And we're also calling non-custodial parents after they come meet us, so that we can make certain that they see if they have any other additional questions and understand what just transpired. Now we also spend a lot of time thinking about how can we change the way the program is perceived in New York City. And this is not just a New York City issue. This is a nationwide issue where the program has undergone significant change, but it's not well understood. Much of the change is not well known, both by community-based organizations and parents. I don't think people understand to what degree we are a strong anti-poverty program. So what we do is we partner with community partners. Where we have mutual clients. Our most recent effort is a partnership with the city's Agency for Child Welfare program. We're working with preventive service programs. These are families who are at high risk of their children entering foster care. We provide training. We provide training to a variety of programs across the city, again, to make certain not only they know about the benefits of child support, to try to connect people to our program, but also to know about our services that are available. We've developed a program. It's an online portal that's called Snapshot, and what it does is it gives community-based organizations real-time access to financial information on a non-custodial parent's child support case, and that's with their permission. And so what it allows us to do is sort of bring customer services right directly into the community. And we don't expect community-based organizations to be experts on child support, so what it does is it gives them pointers on what are the next steps the non-custodial parent should take to address possible issues, and it affords them access to a number of videos, brochures, forms to fill out for our debt reduction programs, and other helpful information. In addition, we've been making videos on parents and how-to videos. So we're creating videos from parents who are on our caseload that discuss their role as parents and their experience with the program, to try to put a face to the child support program. And we know the program is hard to navigate and complex, so we're creating really short how-to videos to help our clients, whether they be CPs or NCPs, with getting through the process, filling out forms, or understanding the process. We're also really proud of the fact that we partnered with CUNY's Silverman School of Social Work at Hunter College to develop a curriculum for social workers to emphasize the value of fathers in children's lives. As Jessica mentioned, fathers make a huge difference when they're actively involved in children's lives as it relates to getting improved child outcomes. So there's a new curriculum. It's not only for current social work students, but social workers who are renewing their social work license. And the same curriculum has been adopted by Columbia University. We hope it'll be adopted by other social work schools throughout the nation. And again, it talks about the value of fathers. It helps define what we're hoping is we shift the perception of this, or the definition of family, from what it's been historically to mother and child to mother, father, child, whether the parents are together or not. And it also lets the students know about the child support program and how its benefit. And its many benefits as an anti-poverty program. And we're hopeful that many of these things that we've been putting in place will create sustainable change for the child support program and help people understand the degree to which we're an anti-poverty program and how we can really create lasting change for children in particular and get better outcomes for children. And in closing, I just want to mention that on October 2nd, we're having a conference that I hope many can attend. It's called Co-Parenting, Opportunities and Challenges for the Child Support Program. And we have a great cast already committed to coming, so I ask you to keep an eye out for it. And so thank you for the opportunity to speak to you today.
Thank you. Thank you so much. And here are some resources that Fran and I have sort of brainstormed about to keep you abreast of new developments and research on father engagement in child support. Our next presenter is Sasha Roscoe from the Department of Family and Protective Services in Texas, and she's going to talk about some initiatives in programs that deal with child health and child development. Sasha, you're up.
Good afternoon. This is Sasha Roscoe. I am the Associate Commissioner of our Prevention and Early Intervention Division, which I'll frame in just a quick minute. Our work is attached to our child welfare system, but we are our own division, and we are granting funds to community organizations to promote protective factors in families so children achieve better outcomes both in health and child development, and also in school and to be ready for school, and then also to avoid entry into child welfare or the juvenile justice system. So we have a full range of supports for families, starting with prenatal support through nurse-family partnership and other nurse home visiting programs. And then we also have crisis counseling or family resource center support, as well as youth mentoring programs for our older youth. But what I'm going to talk about today is obviously the areas of focus we have for fathers in particular. So we do fund, in total, we have around $105 million that is funding supports and services to 67,000 children and families around the state of Texas. But we have 4 communities in which we're funding fatherhood work directly. That's our Fatherhood Effects program. We take a public health approach to our work of promoting safe, stable, secure relationships. So we also have public awareness efforts we have targeted to dads and the general population that I'll speak about. With all of our work as well, we've learned, and I'll say this probably a few times, that it's not enough to just serve the family, we also want our funded organizations to learn from those families what they needed outside the services and work within their communities on collective impact or other systems change efforts to get other supports aligned with safe, stable, secure families. So we've taken a lens towards fatherhood support and father-friendly systems in thinking about supporting that effort. And also aligned with our public health framework has been an area of our focus around understanding data and maltreatment risk in communities, and how fathers fit into that, both from a risk and a protective capacity in particular. And so we've done some work there, and I'll just say, just real briefly, of the families we've served, in total, 13% of those primary caregivers we've supported have been men. 11% of them were dads. And then 72% of our secondary caregivers we've been working with have also been male. 53% of those were dads. So that just kind of gives you a little bit of a scope. And before I dive into our direct fatherhood work, I'll also say in a variety of our initiatives, we've seen some unique fatherhood initiatives at the community level outside of direct fatherhood education or support. We've seen navigators in communities specifically assigned to dads working either even attached to domestic violence shelters or just navigating bigger systems or having Father's Days in the parks. And we've also emphasized in our home visiting programs, done a lot of training and technical assistance with those practitioners to make sure they really do know how to engage the father in those services as well. So we really do have a multi-lens view on fathers as kind of really specific parts of the family that need specialized focus. So moving on to our direct work, though, our Fatherhood Effects program. These are 4 communities. We have two border communities, El Paso, and then Southeast Texas, as well as Fort Worth and the Austin area, where we have fatherhood programs working with either 24/7 dads, nurturing fathers, or the Man and Me curriculums, but also wrapping around basic needs support, group-based parenting, support groups, job skills and readiness, and again, working at the community level on collaborations and public awareness. We have outcomes attached to all of our services. We use a pre- and post-protective factor survey where we measure what we consider 5 protective factors against child maltreatment, and that is the attachment between parent and child, the parent's knowledge of child development, their actual social supports and their perceived social supports, and then, of course, their access to basic needs support. So we measure that pre- and post-service as an outcome measurement, and then we also match all of our families against our system of child abuse and neglect to determine that we have, in fact, diverted families away or kept their children safe from abuse and neglect. And we do that during 1 year out, 2 year out, and 3 years out of our services as a measure of effectiveness. We've served a total of 700 dads through these efforts, and I want to highlight one of them in particular because it's sort of unique, and this community came to us rather than us really putting out funding and have someone designing something around our goals. And it's a program called iDads, or Involved Dads of Action, Developing and Succeeding. It's something that was developed with the Housing Authority of the City of Austin, or HACA is the acronym for that, and Isaac Rowe, the founder of the Man and Me, they created this curriculum, iDads, together. And when they came to talk to us, one of the unique things about their approach, besides, of course, embedding both outreach, engagement, and services in public housing, which is fantastic, but they also have this really fresh approach to just serving the public housing community in general, which is obviously a lot of the dads aren't part of the housing project, and there might be a lot of rules about their presence in the housing. But they took a very child-centered approach that these were still the fathers of the children in their housing, and that mattered, and that was their avenue towards serving their dads. And that so in this program, for 5 weeks, participants attend 2 90-minute sessions for a total of 10 sessions. They have about 5 cohorts going, and it's mostly word of mouth, which is we've found to be one of the more successful ways to really engage families voluntarily when there's not court-ordered involvement, which is true for all of our programs. All of the programs we fund are voluntarily engaged by parents and not serving court-ordered involvement. So that has been a unique partnership that we funded for that we hope to learn from and share with other public housing organizations throughout the state, or perhaps even across the country. So some of our programs too do serve incarcerated fathers. So that's been a unique group that some of our communities have decided to go and engage, but they're not necessarily designed for that purpose, but we do allow that. Sometimes also our juvenile detention centers or teen dads in high schools have been another specialized group we've seen some of our communities work with in their fatherhood programming. In our public awareness efforts, we've really, to just kind of give some of that context, when I started in the Prevention and Early Intervention Division in 2013, our public awareness efforts were still very much focused on child abuse awareness. And so there was a lot of those sort of dark, somber ads or public service messages, sort of emphasizing how awful it was to abuse or neglect children and how we all needed to come together and report or identify and protect children from abuse or neglect. And as we started trying to scale, particularly home visiting and try to figure out exactly how do you engage, create a norm in the community so that parents want to learn how to better parent without feeling shame or stigma, we sort of decided that these ads we were funding kind of might be achieving or working against us. Because most parents see those ads and they don't identify themselves as being someone who might potentially abuse or neglect their child. Everybody sees that as someone else. And what we were trying to get to was a little bit further upstream to identify with just those parents who are just feeling stressed, and to create a norm where parents felt they wanted to reach out and normalize the idea of getting help and education in this very complex job of parenting. So what parents told us in lots of focus groups was that just parental stress was something they were struggling with. And so we really changed our way about how we designed campaigns. We started talking to parents a lot more. And one thing we stumbled across in some research work we were doing with the University of Texas was a group in a partnership with our film and radio, television, and film department at UT Austin that was working on a fatherhood application, or an application for new dads, or what we call the Fatherhood Playbook. And so we partnered with them. They had already talked to a lot of dads and a lot of Spanish-speaking fathers as well. They had done a lot of pre-work to get to this app, which is pretty much really intended to be a classic what to expect when you're expecting kind of app. But instead of marketed to moms, it's marketed to dads. And they'd already worked on color palettes and lots of other schemes that seemed to resonate with the men they had already done focus group work. And so we also came along and started partnering and funding their work. And got feedback about what dads are looking for. One, they are looking for support or education or materials or even advertising aimed at them. They feel marginalized, but that they wanted help, particularly around financing. They're still seeing themselves as financial providers, a key father role, but also around how to help when a child's sick. That seems to be an area where moms are all of a sudden willing to accept a little bit of advice and help, and they'd like to be prepared to give it. So this is something we've just now has moved out of beta testing, this Fatherhood Playbook app, and is available on the Android platform. It's still not available on the iPhone platform. So that's just one area of something we've developed for the kind of population level fatherhood work. And then back to our more traditional ad campaign, running with this theme of stress and sort of a normalizing the routine stress points of parenting. We've developed some short animated series, and two of those are focused specifically for fathers, or first-time fathers, and then how valuable fathers are. The tone of all these ads is very encouraging, very much like, this is going to be hard. These things that you're struggling with are really normal. Everybody deals with them, but you've got this. You're going to be a great dad, and it really matters. So I'd encourage you, you can find both of these at our helpandhope.org website, and feel free to link to them. They're on YouTube in their video format. I mentioned that a lot of what we do to support the work, again, is not just funding the direct service, but then also both encouraging, sometimes requiring, supporting, training all of our community-based organizations about taking that work with vulnerable parents and either participating in or even sparking and leading systems change and collective impact efforts so that families, should they also need help connecting to or accessing health care, transportation, housing, child care, whatever their needs are, that they can either find it or if it doesn't exist in the community, they could perhaps build it. We do this work, we do this sort of systems level support work in a variety of ways. We have training. We have a large annual conference. We often pool consultant hours or provide training or technical assistance hours to our contractors that they are grantees so they can access that type of training and support and consultation at their local level. And then we're partnering with Cynthia Osborne, who you'll hear from later, on our third annual round of fatherhood summits, where we are trying to also boost the level of knowledge, education, and tools to do the important work. And then the last thing I want to mention about the work that we're doing here in Texas around fatherhood support is some work we're doing at the hospital level. We're really trying to engage at the health sector because this is where parents first become parents and engage with professionals to seek advice. So we have one initiative in our birthing hospitals to try and roll out abusive head trauma prevention training, which might otherwise be known as the period of purple crying, to try to target that specifically to dads. But what we've learned is if we add to it more more anticipatory guidance around safe sleep and car seat safety and some of the other many messages, that it's better received. So we're still sort of working on that exact toolkit, if you will, or effective way to target fathers at the hospital level, the birthing hospital level. And then we're also rolling out in 4 communities the Family Connects model out of Durham, North Carolina, which is a postpartum nurse home visit that would, at full scale, goes to all new babies, and obviously would be a way to contact both moms and dads in the very beginning of the life of a new child, and it's meant to be more of a navigator than an education model, and again, to connect them to other systems and supports, but also to create a sense in a community that we acknowledge you don't just go home with a baby and know what you're doing, that you will need help, and that there are services available to you. So that is a very quick flyover of the work we're doing in Texas around fathers.
Thank you. We have some resources that Sasha recommends if you want further information on engaging fathers and in early health and child development areas, and again, this will be on our website. We are going to move to or continue more, but do more explicitly in child welfare realm with Fernando Medeiros and Ann Ream. They've collaborated on a presentation that discusses how child welfare agencies can better integrate fathers, starting with their recognition of their importance and their location, providing ongoing support during ongoing services, and addressing special needs. So I'm going to transfer the baton to Fernando and Ann.
Okay, good afternoon, everyone. My name is Ann Ream, and I am the Department Director of Community Relations and Foster Care. In my previous role, I was a Department Director of Protective Services, and that's really where my love and passion came in, respective to working with dads inside of child welfare. I was asked to go to a leadership summit on fatherhood and got to meet people around our area in the Northeast Ohio area that were really just as passionate about working with dads. And I came back and began to process what I did in the field to work with dads, which was almost next to nothing. And as a department director and a leader here at the agency, I started talking about our upper leadership, about what we can do to expand our work with, when we were really starting from very basics, to begin really what became an initiative for working with fathers inside of the child welfare system, and that was about 10 years ago. So we went to our executive director and really started a multidisciplinary approach with folks from the intake department, ongoing, our placement department, foster care and adoption, and even our legal team. Multidisciplinary approach to really look at why we work with fathers and why this is so important, and how we can start guiding our work in child welfare. We would not have been able to do this approach at my level unless we had that buy-in from our leadership to recognize the importance of fathers and locating and engaging them, and really recognizing as an agency inside of child welfare that fathers bring strengths and that they're important to the life of their children. So we got that leadership buy-in, and without that commitment, plans will falter. So we were fortunate that we had the buy-in and that commitment from the top down and the bottom up, that we had organizational efforts that really require that baseline to be able to establish the program in which we did here at Summit County Children's Services. And recognizing that engaging fathers is really a culture shift that in child welfare agencies, this is a unique approach that we began inside the walls of child welfare to begin our practice with dads and practitioners and looking at stakeholders within our agency and in our community. And, recognizing and also knowing that when fathers have the opportunity to be involved with their children's lives, that they can make a substantial contribution. And we have mostly women inside of child welfare, and that's certainly true here at Summit County. However, so you have to be prepared to hear things like, why are you doing a fatherhood initiative? Are you going to do the same thing for mothers? And we know that through our work and research that child welfare generally is mother-centric. So we have to work with and learn to work with dads in a different, more unique way. And research puts that into our reality. Working with dads early in the assessment and throughout the life of the case will lead to better outcomes for the kids that we're working with in child welfare. So engaging fathers will contribute to their safety, permanency, and well-being inside of child welfare. These are the outcomes that we are in this state, locally, and nationally, that we're looking for, that safety, permanency, and well-being for the children that we're serving. Also, we created a fatherhood involvement policy and procedure, and I can get to more of the crux of that. So we really began to turn the wheel inside of the walls of child welfare to begin our approach and to kind of bring that baseline to the practice that we do with fathers. Assessing their strengths and bringing them into ongoing practice, and always taking into account the best interests of the child. Because of that work that we did with inside of child welfare, we also did some state work and came up with a best practice guide through the Ohio Department of Jobs and Family Services, and it was a part of a 5-year child and family services plan, because Ohio we were struggling like many states to working with dads. So we know that involving fathers brings positive benefits to our children that no other person is really likely to bring. So recognizing that and putting that into practice will be the game changer. Also being able to identify some of the special issues that our dads sometimes bring to the table. Many of our dads that we work with are low-income men, for instance, and poverty can be a factor of why we have to engage the dads differently. Dads may feel like they don't have a lot to contribute, and maybe they're underemployed or unemployed, and that really hurts in terms of their self-esteem, and that they don't have the money to be a good dad. And we know that spending time with your child and playing with them is really for free, but we have to encourage and engage dads in those kind of discussions and assessing them for the strengths that they do bring, and that will help us make those steps forward. Because this is sort of a dual training, I'm going to ask Fernando to jump in a bit and talk a little bit about why we are engaging fathers and the importance of that.
Yes, and again, this is Fernando Medeiros, and I am on this call today because I was Director of Fatherhood Engagement in the Massachusetts Child Welfare Agency for 9 years. So I share a lot of Ann's experience. I just wanted to add that we don't have an enormous amount of research about fatherhood engagement in child welfare because fathers, in fact, have been essentially missing. Not totally, but essentially. These are low-income men. Maybe two-thirds to one-half of them are not living with the mothers and the children. And the ones who are living with the children may often themselves be ignored. There's just a tendency not to think of fathers, particularly low-income fathers, as a source of stress. So the research has told us that, and this is preliminary, that when fathers are involved with their children, including non-biological fathers, or what we often call social fathers, male caretakers at the home, when they're involved with the children, children benefit greatly, and the majority of fathers and social fathers seem to have a positive impact on kids. A few of them at the same time have very negative impacts and can be harmful. That, in a sense, strengthens the need to work with all fathers so that we help those who can move forward, and we also understand those that maybe pose greater risk either to the children or to the mother, et cetera, and are able to identify them. We also have found that including out-of-home fathers in following up with children who are in foster care seems to produce better outcomes, shorter case involvement, children returning more back to the mother and to kin in general. And third, families tend to not return to the system as often. So we'll be doing more research, but it's fairly limited at this time. And?
Okay. So recognizing the importance of all fathers and the value that fathers bring to their children in child welfare is definitely paramount. Committing to identify, locate of all fathers, involving fathers in all aspects of case management from assessment, which is our front door, all the way through the closure of your case. Engaging these fathers in the aspect of the workers is the caseworker's responsibility that helps progress the goals of safety, permanency, and well-being once again. Making those diligent attempts to involve fathers and certainly documenting, because we say here in Summit County, if you don't document, it didn't happen. And looking at the caseworker to be that game changer, letting them know that what they do and how they work with dads can really change the course of the case, involving that father and empowering them can in turn then help that child really develop further in their lives. Reviewing existing policies and procedures is big, and it's very important, because when we did that here in Summit and looked at our policies and procedures, again, what we found were they were very mother-centric, and they were not inclusive of fathers. So in order to start engaging fathers more effectively, our work group really identified that we needed to have a father-specific policy and procedure that drove our work here in child welfare. And so we have one, and it's been in place for almost 5 years now, and it very specifically says that our agency recognizes the importance of fathers in the lives of their children, and we're committed to identifying, locating, engaging fathers in child welfare. And it proceduralized, just like I had said, from the very top of the assessment all the way through the closure of the case, and it puts very specific roles and responsibilities from screening to assessment ongoing, all the way through placements and legal responsibilities. So it kind of holds our feet to the fire to say we have that level of commitment that we're going to ensure that our agency has father-specific policies and procedures and practice. So we are a good example of that. And that shows our commitment using that. We also, because of our leadership and that importance of involving our leadership, we've used all-staff meetings with the theme of fatherhood to engage staff and to be able to share that, shared message that fathers are important to this agency. So, and we're very visual also about the importance that we stress about fathers. So every other month we do newsletters that are all over our bulletin boards and our walls here to just continue to make sure that our staff are always factoring in the father and the dads in all we do so that we don't forget about them and go backwards in terms of our practice. Again, understanding the challenges for the low-income fathers, we need to be sure that we are dispelling any stereotypes that we have about fathers that may be disengaged or uninvolved or unwilling, and recognize that the fathers do care about their kids and may show their commitment in different ways. Back to the policies and procedures as well, we're lucky here. We have a database in our system that we can use, and we have ability to run reports to see how we are working with fathers and identifying them and including them on the case plan, and also the services that we're providing for the kids. So here in our agency, we have over 850 kids in custody, and the last report that I ran indicated that we have over 90% of our children that we serve we do have a father that has been identified and located. And I can tell you kind of where the rub is making sure that we are engaging those fathers and we're documenting it. We serve 1 out of 11 kids in our county. So having that database and being able to go back and prove how we've increased our efforts to locate, identify, and engage dads helps in this process. Okay, key practice, initial engagement strategies. It starts with the screeners, and I had said that we do have a policy and practice to drive this opportunities. Our screeners, which is our hotline staff, they should be obtaining information about fathers, including alleged fathers and non-custodial fathers, and documenting that information in the database. This can help agencies identifying the father before a case is open. So the more we collect from up front before the actual formal assessment begins, the better. You can cross-reference that information with the family history in the database and possibly resolve any presenting problems quickly by identifying these resources, such as the fathers and paternal family. So that's kind of putting them, on the hook from the front door all the way through the back door to be sure that we're all engaged in this process and that we're committed to fathers. So again, we have that procedure that drives our best practice here. For the screeners, we ask that information and collect it from our referral resource. So before the referent gets off the phone, they can be assured that we're going to ask questions about the father, such as where they live, where are the places that they hang out, where are their places of interest, any father friends that they have, do they have contact with them, do they visit their child, what does that look like, where's that at, does the fathers work, do they have a job, and any of the paternal fatherhood or father relatives, finding that out. We also do use search engines here such as Accurate, and it helps us build a family tree. So if we can get a name, sometimes we can even have birth names. We've done letters out to dads to be sure that we are exploring all father opportunities to identify, locate, and engage dads. Training is a big component here at our agency. We recognize that our caseworkers need more information about the why we involve fathers in child welfare, and how do you engage fathers. When we started changing our practice 10 years ago, I had a caseworker come to me and say, okay, I've got a dad in the lobby now, what do I do? So we don't want to just think that that culture shift is going to come without having more knowledge and more training for our caseworker staff. We also have to recognize that our caseworkers can and do come with biases, and that is the number one barrier that we have found to fathers participating in the case plan. And so our experiences and our views about fathers and experiences have colored our way of how we may or may not work with dads. So we have to be very aware of our biases when it comes to fatherhood practice. And being sure that we always, throughout the life of the case, are inquiring about that father in each contact. And again, acknowledging that fathers must play an important role in that assessment process. And really, your assessment is not done until you have had that father contact and you've assessed his involvement with the children, whether they live in the home or whether they don't live in the home. So your practice is not considered complete until you've addressed and understood to the fullest the role of the father. Okay. On to key practice and assessment procedures, just building on those strengths that the father has. Here at Summit County Children's Services, we have what we call a family team meetings and team decision-making meetings. Many agencies may have other family meeting models. These meetings are really decision-making meetings, and they are strengths-based. So, it's great when people can come to the table and hear, first and foremost, what is it that you bring to the table and bring to your family and to your children that are strengths, so that we can capitalize on those strengths and then begin to work those challenges in from the strengths-based perspective by honing in the strengths first. And it helps to develop that sense of hope and vision for dads and families. Educating the men on the impact of their behavior on children is important to the nurturance and self-esteem and trauma role modeling for children. So let the fathers know what the research says about the important role that they play in their life. Many of these fathers have not been told themselves why it's important because they have not had that role model themselves. Let them know that it's so important for them to be involved because their children will do better socially, emotionally, academically, and physically. We have family interaction and visitation right here on our campus, and the supervisors that run that center down there are so fatherhood engaged. We have more fathers down there visiting because they're talking to these dads. They're encouraging them, and they keep coming back, and that will be a game changer for these children in the case, in the big picture, in the scope of the case and the outcome of permanency for children because of that engagement piece. Key practices on going services. So just effectively involving fathers in the case planning can present some unique challenges because fathers, they respond different than mothers, and we have to acknowledge that. At our agency, we've been fortunate to partner with a practitioner that are right inside the walls of our agency, inside of child welfare. As far as I know, we're the only child welfare agency that had a practitioner inside of our walls. They spent 4 hours a week with office time, and in the classroom, they had 2 classes per week with men that were in child welfare that had active cases or intake cases that were invited in to their classes, and our facilitators would facilitate the 24/7 dad class from the National Fatherhood Initiative. So it became very normalized here in child welfare that we were father-friendly, and we had opportunities and advocates, if you will, for the parents to be able to have a fatherhood practitioner who would come here and listen to them, and actually the practice became better. They were sort of the conduit between the worker and the father, and oftentimes they needed a place to put their stuff, their feelings about why they have now an open case in child welfare, and that practitioner is there to help bridge that gap of communication between the caseworker and the father. So I think it really helped to that engagement piece inside of child welfare. Fernando?
And I'm going to give you a little warning. You've got like 2 minutes, okay?
All right. So I'm going to go on to the next couple of slides. There are special issues in practice that really need specific attention, both in training and in terms of thinking them through. Just go back. Okay. So co-parenting is something that the workers need to know that if they're working with a mom, she may have concerns about the dad. Maybe they broke up in a bad way. Maybe there's been domestic violence. what are her concerns? How do we work with him in a way that's safe for her and also helps him move forward without necessarily letting him know that we got the complete picture of the concerns from his partner. We may have to make sure that we get it from other places also. In addition, this whole practice, including the fatherhood groups, helps men deal with a whole series of issues that you may have heard us mention before. And Francis really had a wonderful program for example, child support issues. It's just a gem. But these are issues that that require special and thoughtful practice. I don't have time to go into them in detail, but just to mention, for example, that if you are working with fathers who have a history of domestic violence, you need to do special things to make sure you don't escalate, that you don't increase risk. So it's just an area of practice that people master and can learn. Are we at time, Jessica?
Yes. Yeah. Okay. Yes. Well, just a minute. How about a minute more? Right.
All right. So I think that you also see there fathering in poverty. This is not a special discipline or something like that, but if you keep in mind that we have fathers who are mostly low income, probably in the 90% low income men in child welfare, many of whom are not living with their families, poverty is a huge issue, and they may also think of themselves as not having anything to contribute. I remember how many times I've heard men saying, I'm a low wallet dad or a small wallet dad, I have nothing to contribute. And men in fatherhood groups, one thing that happens is that they learn from each other and they talk about what can you do with your kids that is not mediated through having lots of money. So these are things that begin to increase resiliency and protective factors for children in our work with dads.
Thank you. We have the resource, the best practices guide that Anne referred to is noted here, and it provides a lot of detail and concrete information for those seeking to replicate. So now we switch to the research realm, and research can be help to drive the father engagement agenda, and Cynthia Osborne is going to be talking about that. Cynthia?
Great. Well, good afternoon, everyone, and it was really a pleasure to listen to all the amazing work that's going on across the states. And what I actually have the luxury of being able to partner with Sasha and the folks at PEI and other state agencies so that we can build this collaboration and research partnership to really understand better how our programs are serving our families and how they might serve them better. So for those of you who have not, I do encourage you to find a research partner or evaluation partner. Right now, the evidence that we have about our fatherhood programs and the things that work from both a policy perspective, a program perspective, systems level, it's modest. The Fatherhood Research and Practice Network has been expanding that evidence base quite a bit in the years that it's been around, but we still have a lot more to learn. And so you can add to this research base, but also you can help to answer the important questions that we need to answer when we're using scarce public dollars about whether what we're doing actually works, and if it doesn't, then how can we make it work more effectively? Can we really understand the mechanisms that are driving what is working and what could be better? And we often find that our programs work for some families, but not for all. And for us to be able to really understand for whom our programs are serving best and who is not benefiting. And also, this research allows you an opportunity to understand whether you're getting the value out of the program that you feel that is you've expected. And often, when state policymakers come asking, you can answer the question of whether it was worth it. I just wanted to provide some sample evaluations of the type of activities that we've done here in Texas that have engaged but involving fathers. We've worked with our home visiting programs to understand both how we can increase fathers' participation in our programs and to figure out how whether fathers actually help retain families in the programs. And I say this a bit flippantly, but it's actually true that the best way to increase father participation in any program, but including home visiting, is to ask them. That many of our programs models were not actually including fathers to begin with. And so by asking and then by helping fathers understand how important they were in the lives of their children, we found that fathers were more likely to participate and then to remain participating in the programs. We also see that families that have a father engaged in the program stay with the program longer. That might be something about the fact that these families are already a bit stronger and more together and ready to receive services. But when fathers are not there, we learn that these families are actually a bit more at risk of falling out of our programs. We also looked at the fatherhood programs, the responsible fatherhood programs that are actually trying to increase employment, increase engagement with their children, increase co-parenting, so that we could better understand why it is that our fathers are coming to those programs, what about the programs are serving them best, and why do they stay, and to learn more about why it is that some leave before they could fully benefit from the program. We've done a lot with our child welfare system, not as much as what we just learned about from Ohio, but we're working with both our family violence folks as well as the child welfare folks to better understand how they can bridge their services, make sure, one, that the families are safe, and that we understand the role of both mom and dad in keeping the family safe. We also worked with our child support division to better understand how they can increase in-hospital paternity establishment. This evaluation was pretty insightful because what we learned was that over 90% of the fathers who actually went to the hospital were establishing paternity, that the hospitals or birthing centers that had low rates of in-hospital paternity establishment were those in which the fathers were not showing up at the hospital at all. So that was insightful for understanding that they were actually effective at their job of getting paternity established, obviously voluntarily, and that the job was really to get to figure out why fathers were not coming. We also did a lot to understand about enrollment in child support and who pays and why they stop. So we use mixed methods approaches of both administrative data, survey data, and focus group data. We also have a special project to understand how we can more effectively serve young fathers. We heard about how important that group is in New York, and that this is really something that when we've talked to dads who are somewhat older and back in our programs, they're lamenting that they didn't have this sort of support when they were younger. But they also admit that they may not have been ready to receive it. But by the time that they are older, have multiple children, maybe with multiple partners, a lot of arrears, an incarceration record, it's harder to help them. And so we want to figure out how we can intervene early. And then we've also spent a lot of time, as Sasha said, that one of their commitments is to figure out how to create systems-level change, not just program by program, but how to coordinate services and then to actually change our policies and procedures across our whole communities. And the child welfare system in Ohio is a good example of how one institution was really creating systems-level change. And what we are encouraging families or agencies and communities who are trying to increase father engagement to go back to the evidence and what it is that we know leads to fathers' engagement with their children. And there's really 4 pillars of fathers' engagement. The most important seems to be that the co-parenting relationship, that the more positive that is, regardless of whether they are married or living together or even in a relationship at all, the more positive that is in terms of their ability to navigate their children and the seeing their children and dropping folks off and making joint decisions, that the more likely it is that the father is going to be engaged with their child. We also know that this is especially true from a father's perspective, that his own sense of financial stability provides him with a sense of confidence to be able to be engaged with his kid, and that it's also important from the mom's perspective that he's able to contribute financially or to at least contribute in some way, if it's not cash, but in kind. And so his financial stability. We also know that there are some dads who are not quite ready to be involved with their kids, that they're making decisions in their lives that they would tell you that they feel are not, don't make them make it so they feel like they shouldn't be around their kids. Either they're still in drugs, or they're in gang activity, or they're incarcerated, or there's violence going on. And so focusing on some of those sorts of behaviors and making it so that these are reduced will actually increase the father's engagement with their kids. And we also know that the father's sense of himself as a father, understanding the important role that he plays, and understanding what it is that he would actually do when he's with his kids, that plays a big role in whether he's going to be engaged. And so when you're thinking in your community or in your program of how to serve fathers, if you're going to increase father engagement, we suggest that you think about it from what we call these kind of indicators of progress. Being able to measure increases in father engagement will take a long time, but you can measure these baby steps along the way. They're not actually babies. Sometimes they're very big, but then you can actually think about whether you want to lead to programmatic changes or these public perceptions that need to be changed, or whether you actually need to put in different transportation routes in order to get dads to jobs where they live and where the jobs are, or whether you need to actually change the policies or the practices and so forth. I could go into a lot more detail about this at some other time, but we encourage folks not to reinvent the wheel and say, well, I don't know what to do to increase fathers' engagement. We know the 4 pillars, and then you can think strategically within your own community, within your own program, about how to really address one of those pillars. I would say that there's still a lot that we need to know, especially about how to engage our non-resident dads, that we know that they still have a big influence on their child's development. We know that they're often having some sort of relationship with the mom, whether it's positive or negative, and that we still have too little information about how to best engage and serve them. We also need to better understand, like I said, the best age to intervene with dads, how to reach our dads early, when, though, are they most receptive to receiving services. We need to understand whether we can generalize any of the things that we find that happen, that work well in New York, if they work well here in Austin or in Ohio, and to replicate and try things in different geographic and demographic contexts. We still have a problem with keeping dads in our programs, regardless of the type of service that we're providing. Retention is hard for all of our families, whether they're moms or dads, but it seems to be especially challenging for dads. It's often related to work. It's often related to not understanding the benefit that the program might have, but we need to learn more there. We also need to understand what the right combination of services are, that families don't operate in isolation, that families who are in the child support system are often in the child welfare system or in the prevention system and other systems as well. And we need to think about the right combination of services and how to work across those systems so that we can actually serve our families in a more holistic way. I put a list of resources here of great organizations that are studying fathers or that have resources for you with regards to fathers or all the findings that are there. The first one is I shouldn't say all great organizations, but I think that this is a good one. This is my organization, the Child and Family Research Partnership, and we have a lot of information on our website that has all the findings that I was just discussing. We have videos of dads who have participated in programs. FRPN, if you haven't perused their website and spent a lot of time there, I highly recommend it. Both Mathematica and MDRC are leading our evaluation work on a national level for fatherhood work, and the National Fatherhood Initiative is constantly putting out excellent tools. And I'm sure that you have gone there, but I encourage you if you haven't. So I'll stop there.
Terrific. Thank you so much. Okay, questions for the panels. They've been coming in, so I'm going to turn this over to Jay to pitch a few and keep the slide up because it gives contact information for all the presenters. So what do people want to know, Jay?
Right. So thank you. The first question was, this is for Fran. What is the name of the curriculum that was developed by Hunter College?
Yeah, can you hear me? Am I on? It's the Fatherhood curriculum, and it is online. We can send out the link.
Okay.
If anyone's interested in it.
What's the name of the curriculum?
The Fatherhood curriculum.
Oh, okay. Then you said that. Okay. Thank you. Next question. This is for, I think, Fernando and Reem and possibly Sasha. For those working in child welfare, do you have any tips on breaking down the barriers in child welfare agencies that minimize and marginalize dads who are involved, even when their deficiencies in those fathers are identified?
This is Fernando.
Good.
In a way, that is the crux of the question. And I would like to say that I think the federal government has helped in the child and family service reviews, the periodic reviews that are conducted, because it does look, not profoundly, but it does look at engaging fathers. So it begins to put fathers on the map. I also think that we have to make attachment. We have to make arguments about the benefits for children, and also, for example, like, children do attach to fathers. They get things from fathers, and when they don't have a father present in their life, which we can actually, and by we I mean child welfare, can be instrumental in. When children don't have a father in their life, they're going to lose out unless their father is abusive and irremediable. So I'll leave it there. But I think it's just something that we're going to continue to have to talk about.
Anyone have something else to add? Or
This is
Anne. We have the Ohio Commission on Fatherhood as well. They helped us, the commission helped us and other counties around the state of Ohio to mobilize communities and look at stakeholders to bring fatherhood to different communities. And so I think when you've got leadership just not only in child welfare, but you have leadership in the greater community who are banding together and also recognizing the importance for fathers, I think that helps as well to help break down those barriers, because you're getting, from the inside out and the outside in, that recognition that fathers are important and that they make a difference in the life of children in our community.
This is Sasha. I would just add, even though it's not in my area, in the prevention and early intervention area, but in the Child Protective Services division of my agency, they do have a fatherhood specialist, Kenneth Thompson, who, or at least my sense of his role, in addition to just going around the communities and talking about the importance of dads, and is it almost inadvertently like an ombudsman for fathers who do have children in the system and don't know how to navigate it, or and they might not be the parent who is really under scrutiny, but they also might be struggling to fight, kind of advocate for their child, or figure out how to advocate for their child, or gain custody of their child. So, I mean, that's just one approach that I know our state has used.
Okay, next question for Sasha. Sasha, you've talked about training provided to home visitors. What type of training is needed, and what are the challenges that you have in terms of getting home visitors well trained?
For fathers, with fathers.
Right, about engaging with fathers in particular.
Yes.
I don't know that whether we've worked really primarily with Cynthia on providing that level of training and technical assistance. And I think in the last few years, we haven't focused specifically on the practitioner, but at more of the organizational level through the fatherhood summits we've been doing. And then we do have three sort of levels of training opportunities for our home visiting practitioners across many models and many nonprofits, and that's an annual conference. We have many conferences, and then we have an online training hub. So I think I don't suspect it's any different than any other practitioner, whether it's a labor and delivery nurse or a home visitor or a school teacher. It's just getting past that emphasis on mom, on getting to see dad as someone you might need to single out separately and be perhaps more welcoming. So I think the barriers for us are also all the other competing messages we're trying to deploy in any given year to our practitioners around literacy or nutrition or safe sleep or postpartum depression or any of the other things that we want these child and family serving professionals to be focused on, trauma. So I think that is something like really engaging dads, unfortunately, is still seen as a specialized area that kind of has a surgence for a while and then does kind of fade into the background as other topic areas kind of compete for bandwidth.
And
okay,
with that, I think we're at 2:29.
There's one other question. I think we've got one minute. So one of the participants asked, is there a father-friendly assessment tool that any organizations have utilized to evaluate father-friendly practices?
This is Cynthia, and I think I saw that Christopher Brown is on here from the National Fatherhood Initiative, and they have a father-friendly checklist tool that they provide on their website, and I would recommend using that. We've created some of our own tools here that are very similar, but I think that is probably the best tool that you can use, and it helps you to understand your organization's both willingness and capacity and readiness to engage fathers.
Okay, so that is all the questions.
Great. Well, this will be posted on FRPN website, the recording and the slides. A big thanks to our panelists for enlightening us, and we enjoy your evening, and we will be back with more from FRPN in another couple of months. So thank you, and bye-bye.
Thank you. This does conclude today's webinar. We thank you for your participation. You may disconnect your lines at this time, and have a great day.